CNBC-TV18 presents Transforming a Billion Lives, Season 2, presented by AWS.
Hello and welcome to CNBC-TV18 presents Transforming a Billion Lives, Season 2, presented by AWS. I'm Ridu Bhandari. Today we delve into a topic that resonates with every citizen of our country. How can India build citizen-centric digital health systems? As our nation strides forward in the digital age, the healthcare sector stands at the brink of total transformation. The government's flagship initiative, the Aayushman Bharat Digital Mission, or ABDM as it's called, has set the stage for a comprehensive, integrated digital healthcare ecosystem. It's a national initiative to digitalize everything from patient records to health monitoring, diagnostics, and service delivery at the very last mile. But in a country as vast and complex as India, this ambitious journey towards a proactive, holistic, and citizen-centric healthcare system is fraught with numerous challenges as well as opportunities. How can AI solve some of these challenges? What can electronic health records or AI-powered diagnostic solutions achieve for patient care? What is the future of digitally enabled healthcare in India? Those are just some of the many questions we are aiming to answer here today with an eminent panel of industry experts. Please join me in welcoming Pankaj Gupta, Country Leader for Public Sector at AWS India, Prashant Warier, the co-founder and CEO of Qure.AI, and Vikalp, Sahni, the founder and CEO of Ekacare. Welcome, gentlemen. Thank you so much for joining us here today. It's a pleasure to have you all. I want to start with the government's flagship mission, the ABDM, or the Aayushman Bharat Digital Mission as it's called. And Pankaj, I know that AWS is involved with the government in a number of its initiatives. ABDM is one of them. Give us a sense then, in the last 2 years, how has the progress been, in your opinion? And, what are some of the big things that we should be looking forward to as citizens of the country?
As a citizen of India, it is such a proud moment for us that India has a history of building some of the world's largest population scale platforms. I'm sure all of us have heard about Aadhaar, all of us have heard about UPI, all of us have heard about CoWIN. These platforms are built for India's scale, complexity, and diversity. Look, ABDM will be the next UPI of health, which is Aayushman Bharat Digital Mission. And again, what really ABDM is doing, help you demystify that, it is really bringing together all the stakeholders. You talk about central government, you talk about state government, you talk about health techs, you talk about insurance companies, all the stakeholders are coming together in one common platform. One of the core pillars of ABDM is giving every citizen of India a citizen health ID. The way we have Aadhaar ID, the way we have driving lessons, in a similar fashion, all of us will now have a central health ID. India has already created more than 618 million health IDs so far. And with that, what is happening is, it is actually democratizing the entire health ecosystem in India. Making healthcare affordable, accessible, equitable, inclusive is the biggest challenge. And again, the reach to the complexity, diversity of India, the rural areas, the urban areas is a big challenge. And with that, the large part of the population access the healthcare from the rural countries, and they access the healthcare from the public institutions. And we all know in the public institution, one of the biggest problems is that even for you to get your OPD registration, it takes hours. And Government of India has come up with a one use case that is built on top of the entire ABDM infrastructure, is called Scan and Share. With that now, using my health app, which could be Arogya Setu, and by the way, Arogya Setu is now evolving into a citizen health app. Using the PHR app, using a QR code enabled barcode, I can send my demographic details to the hospital with a single click of a button.
Nice.
Now with that, it has again changed the paradigm with that. And again, the important thing that I want to highlight is in terms of the impact for the citizens. Earlier, it used to take 50 minutes to create a digital OPD registration, but now with Scan and Share, it takes only 4 minutes. That's the kind of impact created for the last mile.
Vikalp, we have about at least 4 generations living together, if not 5. The median age is 28, but the population is spread across various age groups. How then can India build a very robust digital healthcare ecosystem that caters to the diverse needs in terms of the kinds of population that we have, and obviously the vast geography that we are spread over?
I think there has to be a need, and a lot of adoption that today happened on ABDM is on the public sector. There has to be a need for more and more private parties to come and start innovating on top of this platform, because India as a country, 60% of our spends for healthcare are out of pocket. And all of this happens in a large number of fragmented private clinics or private nursing home or private hospitals at private doctors. So there has to be a private sector innovation which can deliver this platform and this kind of a digitalization across the board. But I think there is something which is fundamental for the digital revolution to take place in the country, and I would rest that on doctors. And we have to make sure that a doctors spearhead this revolution of digitalization. There is this healthcare provider which is doctor, who again speaks all kind of languages, who is there across the geographies. He understands the population well, whether it's a young population or an old population. So a lot rests on the doctor's shoulder to take this to a next level.
Prashant, if I can come to you, can you provide a few specific use cases where you're experimenting with artificial intelligence, the kind of impact that you're seeing in terms of intervention when it comes to healthcare, and if you can give us a few success stories with AI.
We build AI to interpret radiology images, and why this is useful is because typically if you talk to any radiologist, they would want to be in the city. They don't want to be in a rural part in Bihar or UP. I mean, if you go to rural side, you'll not find radiologists reading scans there. And that is a big gap, not only in India, but across the world. And today, our solutions, Qure.AI solutions, are in 90 countries. We are a made in India company founded in Mumbai. We are in 90 countries in about 3,000 hospitals and solving major challenges in reading scans, reading X-rays and CT scans in various parts of the world. And one of the challenges that we are solving is tuberculosis, right? There are about close to 10.5 million TB patients every year around the world, of which about 1/4 are in India. And many of these are not diagnosed on time. Some of them are not diagnosed at all. They take other treatments and they don't get diagnosed quickly. And one of the challenges is that you take an X-ray and the X-ray is read sometimes days later, sometimes weeks later. And that person is waiting for that X-ray to be read so that they can go for the next test, which is the sputum test. And that is a challenge because now that person who's got TB, tuberculosis, is spreading TB to their family, their co-workers and so on. And they're not getting diagnosed because the X-ray is not being read. And one of the things that we innovated is basically getting that X-ray read automatically by AI within seconds. So now what is happening in various, I mean, again, in probably thousands of sites in India and about 2,000 plus sites across the world, is we are reading those X-rays, X-ray gets taken, it is read by an algorithm, and the algorithm is producing an output which identifies if that X-ray has TB or not within less than a minute, within 30 seconds actually. And then you can decide to do a sputum test for that person. And you can, within a day, within, in fact, couple of hours, you can confirm TB or not and start that patient on treatment.
Pankaj, help us understand with examples what EHR can really do for a country like India. Are there early use cases that we are seeing and the kind of impact that's already happening at the grassroots level?
In India right now, we have created 618 million unique health IDs. At the same time, as part of the ABDM, we have generated over 300 million health records. And by the way, those numbers are just getting started. On a daily basis, India generates close to 6 billion digital health records. And now, I think digitization of health records is great, but the problem is there is a scarcity of the medical history records or the patient history. Now with that, just to give an example, COVID is now evolving into something called a universal immunization hub. With that, what will happen is, beyond the COVID vaccination, what used to be earlier, 12 more vaccines, diphtheria, BCG, polio, tetanus, will be added on the same platform. And now, we don't have to maintain the vaccination records for a child. The moment a child is born, we will be able to create something called a cradle-to-grave longitudinal health record of a child. Right. That is one thing. Country like India, every year there are close to 100 million children in the age of 0 to 6 years. Yeah. There are pregnant women, there are lactating mother who needs to be vaccinated. Now we'll be able to create a vaccination record, a QR code-enabled vaccination record. But the important thing is the benefit to the policymakers. India also has a major problem of malnutrition or very high infant mortality rate. Now with this digital records or digital data available with the government, they will be able to make those targeted policy interventions based on the demography or any other factors. That is for the policymakers. Arogya Setu evolving into a citizen health app. Now think about a scenario. As patients, today we need to take a second opinion about a consultation. What do? We need to carry all our physical health records. But now what will happen is, with the digitization of all the health records, using my Arogya Setu app, and by the way, Vikalp just spoke about, he's also building an app called Ekacare. Using these similar apps, I will be able to link all my existing medical records or all my new records. and stored them into something called Health Locker. I'm sure all of us use DigiLocker. It is again going to be the same concept. Anytime, anywhere access for all your digital vaccination records.
No, that the idea is great, and it's fantastic that it's already in progress. But Vikalp, since you're in that space, tell us what are the biggest challenges when it comes to a country like India? Because in the West, electronic health records have been around for a long time. But India has been a sort of a laggard when it comes to adoption of EHRs. We're seeing movement, but what are some of the unique challenges that we face as a nation?
India definitely is lagging on EHR adoption at the healthcare provider levels. If you look at West, there are a lot of EMR solutions, EHR solutions that has been deployed, be it hospitals, be it at the medical facility. But if you look at them, they are all being driven not by a motivation of using a product, but by a motivation of either a mandate or a payments. Like if you look at US, the payment has to flow through their standardized solution. And that is why there has been a significant investment that has gone in. And I think many of such things, incentives and mandates would come in India as well. But the other big challenge that India has is a healthcare provider or a doctor-patient ratio. And in India, if you are a very renowned doctor, I mean, people will spend 2 hours, 3 hours, even at the waiting room, and doctor have to do the decision-making much fast. So the products that has so far been built, the EMR solution for digitization, the healthcare record solution, they also have to evolve for the India needs. And I'm pretty sure the way technology is moving now, with AI coming in, making sure that voice is being used in many such solutions, I think we will spearhead, and with ABDM as a foundational backbone, we will spearhead, and very soon, like any other like digital goods ecosystem, we will be far ahead of the West.
And that is the hope indeed. On that very positive note, let's take a short break right now. But on the other side, we'll talk about how artificial intelligence can help solve some of the big challenges of digitalizing healthcare in a complex and vast country like ours. The conversation continues on the other side. Stay with us.
CNBC-TV18 presents Transforming a Billion Lives, Season 2, presented by AWS.
Welcome back to CNBC-TV18 presents Transforming a Billion Lives, Season 2, presented by AWS. On the show today, we are asking the big question, how can India build citizen-centric digital health systems? Well, Pankaj, we've been talking about the scale of the country and some of the unique challenges, especially as compared to other emerging economies or developed nations in the world. When you look at challenges from a macro perspective, what are some of the biggest ones, especially when it comes to ensuring universal health coverage for 1.4 billion people? Not an easy feat at all.
The first challenge that I want to talk about is about the interoperability about the health data. If you see today, government is already making efforts bringing together the siloed different departments or system, like there is a separate non-communicable disease system, there is a separate TB system, there is a separate vaccination system. They're trying to get that all together. But the biggest challenge today that you have is in the bigger hospitals who have their own HMIS systems. They have their own protocols, they have their own standards, and unless and until this data starts talking to each other, we are able to make it seamless, interoperable, we will not be able to get the real power of the electronic health record. That will not happen. And for that, I think Government of India is thinking of building ABDM in a way which is based on open source, open APIs, open standards. That means everybody can embrace the change. And I would like to give an example of another key part of the ABDM ecosystem is called the claims exchange system, which is again a standardization of the e-claims processing. What will it really do is it will have a standardized format which will accelerate the payment processing in the system. And with that, you don't really have to wait for hours, as in when you're looking at getting your discharge summary from a hospital. So it'll be a paradigm shift with the e-claims exchange. Now, the second blocker that I see in the ABDM is the sheer adoption of the ABDM system. Vikalp spoke about two parts of the ABDM. One are the patients, another is the doctors. I think the bigger problem is with the doctors, because right now also doctors are in a wait and watch mode. But very quickly, they will have to adopt the digital tools so that we are able to take care of not just the demand side, but the supply side as well.
Prashant, how can AI help solve some of the challenges that Pankaj spoke about? And also at Qure.AI, you are also experimenting with AI in diagnostics. So give us a sense of, where else can AI be harnessed? What is the untapped potential here?
The best part about AI is that it can scale to millions or billions without, and on AWS, right? You can basically deploy it on an AWS platform. It can scale up, right? It's not limited to number of doctors. It's not limited to number of radiologists, for example, where we operate, right? And one of the challenges we are solving is around lung cancer. About 85% of lung cancer cases in India and globally are diagnosed late. And this means that the patient don't survive very long. Survival rate is 5% at that when you get diagnosed late. How do you diagnose lung cancer early, right? So one of the ways to do that is to look at X-rays that are taken for routine reasons. You can actually score those and basically think about AI sitting on the back of each one of those X-rays and scoring each one of them and saying that, okay, this could potentially be lung cancer. It's identifying a nodule, which could be indicative of lung cancer. It's identifying a risk of lung cancer. And what we are seeing is that by doing that, out of 100 X-rays that are taken, we can identify one, which is potentially lung cancer, and that patient can then go and get a CT. And from a CT, you can get a biopsy and then diagnose lung cancer. And what is happening is with this, right now, across so many different geographies, we have seen this, that patients who are early stage, really small nodules in their lungs, we're able to identify lung cancer early for them, get them treatment, get them either a surgery or a lung cancer therapy. And that is something which can really change diagnosis of lung cancer globally. And so that is one of the use cases. Again, there are other use cases around stroke, where stroke patients come into a hospital and they get a CT scan, head CT scan or CT angio, and there is a delay in treatment. There is a delay in diagnosis because of that. So there's a delay in diagnosis. Because of that, the treatment gets delayed. And the diagnosis is dependent upon a radiologist reading that scan. Now with AI can again interpret that scan within seconds, and it can alert a neurosurgeon or a neurologist or even the radiologist that this is potentially a stroke patient who's come into the hospital. And you can treat that patient much faster, I mean hours faster, by the use of AI. So that is the power of AI, speed and scale, that it can do things faster and it can scale up to a large volume without, automatically, basically by just scaling up the backend processing, you can scale it up to a large number of sites.
Vikalp, the Universal Health Identifier, or UHI, is a system that connects health records, it links information across sectors, and it reduces the risk of data breach. And in India, that system is called ABHA. So what is the role of a system like this in enabling the whole digital healthcare ecosystem, especially as we are aiming for universal health coverage for 1 billion plus people?
ABHA is the foundational block of the digital revolution that we all are talking about. Let's say there is Dr. Mridu and there is Dr. Pankaj and Vikalp is a patient. I visit you first, and today how it works today is, without ABHA, you will create my ID in your clinic with a name and a number. Then I visit Dr. Pankaj. Dr. Pankaj will do the same. How do I identify whether it's the same person? And that identifier is ABHA. Now let's fast forward, say a year from now, I believe it should happen in 6 months. I go ahead and talk to Dr. Mridu that this is my ABHA ID. Now Dr. Mridu would create a record for that ABHA ID. Then I will go to Dr. Pankaj. The good part there would be Dr. Pankaj, by writing the ABHA ID that I shared with Dr. Pankaj, he can actually access the records provided Vikalp has given the consent that Dr. Mridu has created. Now, that kind of a universal health identifier of an individual is foundational. It solves so many use cases. Teleconsultation is a big thing nowadays. Think about, how do I access medical records of the patient that I am trying to diagnose on a teleconsultation? A digital ABHA ID led pull of record or fetch of record will enable that. So it's fundamental, and that is how today the ecosystem is working. And as Pankaj mentioned, government has already created more than 600 million ABHA IDs.
Coming to you then, Prashant, in terms of harnessing digital solutions for customer-centric outcomes, what's the role that the ecosystem really plays? Are there any ecosystem-related success stories that you can share with us?
We are only a technology platform, right? And we need ABHA, we need the EMR platforms, we need doctors to start using this kind of technology, we need health workers who are going onto the field and doing TB screening. I think the ecosystem has to come together, and I think the digital health ID powers all of that, right? And technologies like ours can fit into that. So any X-ray that is taken, that can be processed by us automatically. So if we can fit into the backend where any X-ray taken can automatically be processed by AI, and you can send the results to any app out there, right? Or you could do that for any CT. And you could also ingest, for example, our AI becomes more robust if you're able to add more clinical information to that. So if you're able to get EMR data and say that, okay, this patient has cough for the last 2 weeks, this patient has got, let's say, fever for last 2 weeks, that actually increases the probability of that being TB, so for tuberculosis. So again, the clinical data adds to the imaging data, and I think bringing all of that together from a patient perspective really adds value to that patient, helps diagnose better, helps them get treatment faster.
So Pankaj, let's do a little bit of crystal ball gazing and try and peep into the future. What, according to you, will the future of digital health systems in India look like? What are the new imperatives, new innovations, or new tech trends that we should all be betting on?
I dream of an India where every citizen of India, they will have access to all the healthcare services, and making healthcare inclusive, equitable, accessible, and affordable for all the Indians, regardless of their location, whether they are in the rural India, whether they're in a metro, or whether in a village, tier 2 cities, tier 3 cities, and also regardless of their social economic status. That is the future that I envisage for India. And again, by the way, this is, I foresee, in the next 2 to 3 years. Public and private organizations have to come together, and ABDM is anyway making that happen. Because unless and until we come together, the real innovation, the real improvisation, the real scale will only happen once government is building, as government itself calls, they're only building these underlying basic frameworks. Like Arogya Setu, while it is a citizen health app, it is only a reference app. What Ekacare is doing is building on top of that. They're adding more features. Similarly, once private sector will come into the foray, talk about a world where we have precision medicine, where we are leveraging genetics data to talk about, say, drug discovery, or maybe precision medicine. So that is the future in terms of the healthcare. The other imperative in India is about bridging the divide between the rural and urban India. The real India still lives in the villages. And for that to happen, the accessibility of services like telehealth, teleconsultation, and by the way, if you have heard about a system that Government of India has built called eSanjeevani, it is the world's largest teleconsultation platform, which does close to 400,000 teleconsultations a day. It is being used by more than 240 million Indians. From the confines of their home, as a patient to doctor, it could be a doctor to doctor telemedicine platform. So those are the imperatives that will really make healthcare more affordable and accessible.
Thank you, gentlemen, for joining us here today. And as a citizen of the country who is concerned about her health, it gives me a lot of hope and optimism to hear from all of you, all the wonderful insights and ideas that you've shared with us here today. Well, that's a wrap of this episode. India's healthcare system is poised to be transformed into an integrated, interconnected, effective, and patient-centric model by 2035, or perhaps a lot sooner, as we heard from our panelists today. India's digital health initiatives symbolize not just progress, but the indomitable spirit of our nation's quest for excellence. On that note, it's a wrap for now. Thank you very much for joining us here today. Goodbye.
CNBC-TV18 presents Transforming a Billion Lives, Season 2, presented by AWS.